Hi, everyone. I'm here today with Dr. Phil Demio, Marlo Thurman with US Autism Association, here with Dr. Phillip Demio, and we're going to talk about some of the medical kind of coexisting things that occur for adults across the spectrum. And a lot of people haven't put those pieces together yet, although Dr. Demio's been doing this for a lot of years and has some really great insights for us. So, Dr. Demio, tell us a little bit about yourself and how you got into this and kind of, yeah, your background for adults on the spectrum who are struggling with maybe some medical
Hmm.
comorbidities or coexisting conditions.
Well, I'm an MD, became a physician about 40 years ago. Seems like it was yesterday. And I have a broad background. I have lots of training with people of all ages. I went through parts and whole aspects of multiple residency specialty trainings,
Mhm.
both in the laboratory where specimens are analyzed of body fluids of all kinds, and everything from emergency medicine, critical care, children and adults care. And I also always had, before I was married, before my wife and I had our son, I always had a private office that was doing some things, and it included alternative medicine. Eventually, that developed in that. So I was doing a blend of alternative and conventional medicine in my years as a physician. Then we had our son, and he developed autism. He has a regressive autism diagnosis from his doctors. He's 25 now. He's a child who was basically normal, and then a little bit before age 2, became very, very sick physically, which is part of autism for most children and adults. And then he regressed, and he's very severe now, but he really lost all of his function, all of his language. And obviously, this gets to me, getting involved with the medical aspects of autism and what we used to call Asperger syndrome, along with other developmental mood and behavioral issues, which have a medical basis most of the time
Mhm.
and are often, as you mentioned, Dr. Thurman, associated with comorbidities of medical illnesses, autoimmune problems, severe gastrointestinal problems, epilepsy. My son has all these. So he regressed, lost all his function, lost all his language, didn't know who I was for over a year. The only person he recognized was his mother. It was really very isolating for him. But this is, one of the cases. Some people are much milder. They get clearly some abnormality they develop, but it's much milder. And so he has had a lot of recovery, and he does not have to frequent the hospital like he used to. He had 40 some surgeries, a bunch of other problems. These are all the medical aspects that are associated with that.
Mhm.
And many of our adults, as he has, continue to have medical problems that are treated, some very mild, some more intense. So I got involved by taking him to doctors, my wife and I. We didn't get much help. And so I found out that there are other doctors out there, small number, who do what's been really, I think, called biomedical treatment, meaning it's medical aspects of the autism spectrum and associated other developmental problems.
Right.
And so we started to get help that way, but it was sort of sporadic and fragmented. And I ended up trying to help him a lot myself, but I wanted to get trained in that area. And I went to several training courses and met many of the people who were on the cutting edge and doing these kinds of treatments and developing them in research. I found that my background as an emergency critical care doctor in toxicology was very helpful.
Mhm.
I was one of the few toxicology emergency medicine physicians in the country who was looking at chronic long-term toxicity, not just overdoses and things
Right.
like this. And I also got interested in that realm and food poisoning and chronic long-term food poisonings. And that came in very handy when it came to learning about, what to do for people with autism. So fast forward, I had a practice for nearly 20 years. I'm now retired out of that. And that's what brought me here. So
Yeah.
we just had that journey as parents. And there are some physicians who've had that same experience, that they just couldn't get help and try to develop ways to help their child. And I ended up doing some research on treatments and things like that for lots and lots of people for many things, including autism.
Right. Well, and I'll share a little bit of story how we got connected. We both were involved with US Autism Association, and those of you who know my story know that I had a traumatic brain injury and had really some very chronic kind of medical issues that include some autoimmune stuff. And like I say, I really learned a lot just by listening to Dr. Demio when he was talking about treating autism, because that affected so many aspects of what I was dealing with. Even though I don't consider myself to be on the autism spectrum, I had a lot of those kind of chronic physical conditions that really I couldn't get
Yes.
treated because I would go to this specialist and they would give me this one thing, and I would go to somebody else and they'd be like, oh no, you can't do that because of this piece. And so is that I was missing. And I think we have a couple terms. We talk about biomedical, we talk about integrative functional medicine. I think those are the three kind of main terms. But until I actually
Yeah.
had somebody who could look at all of my stuff in a whole system and tie that to my sleep and my nutrition and my inability to exercise because of health issues, and some allergies that I had and some stomach issues that I had. And it was like until somebody put all that together, I couldn't heal. And I think I learned that from you, Dr. Demio, that we really have to look at the whole system sometimes before we can get to the bottom of what really is going on. And I think in autism, that's so true,
Yeah.
that whole autism system can be kind of dysregulated. So let's start with the question I had, and I know it's an important one for both of us, but this idea that what does autism bring to the table that makes it so these conditions are more prevalent? Because we know in autism that we see that. Do you have any thoughts about what that is, why autism does have these co-relationships to some of these physical health conditions?
Well, I think it's simple, but it's not widely known or accepted or spoken about. Autism is a medical problem.
Mm-hmm.
And just like some medical disorders, after having a stroke, having diabetic reactions, having medication reactions, these are medically based things that can lead to mood, behavioral, cognitive dysfunction. And they are very challenging, and they're not separate. They're part of the problem. Then it's okay to treat the mood and behavioral problems separately, but they do go along with medical problems,
Right.
particularly GI and autoimmune issues.
Mm-hmm.
And so these are the issues that we see with people. Whereas generally speaking, in most of the self-appointed mainstream medical community, autism is thought of as a purely psychiatric disorder. And there's talk about genetic tendencies toward it, just like there is in schizophrenia and just like there is in bipolar affective disorder and depression and some other things. But they're all thought of as psychiatric disorders, and they just need psych meds and therapies, and that's it, and nothing else works, and it's the only thing that works. Those phrases I just mentioned, just now, Dr. Thurman, and to our listeners, I've heard that many times, that there's only one thing that works. It's therapy, meaning non-medical treatments, psychiatric treatments, and that's the only thing that works and nothing else works. Well, that's not true.
Yeah.
A diabetic person who has a stroke, or a person with high blood pressure who has a stroke, or a person with high cholesterol who has a stroke is told to go on a specific diet. They get a CAT scan. They get medical treatment. They get medications that are aimed at their metabolism, what they do with their calories and the food they eat. It's aimed at the way their body heals and cycles through things with their cells.
Yeah.
And there are things that are tested in people with those disorders to see if they have anything from toxins to, and these are standard treatments, to toxins to other known causes of high blood pressure and,
Mhm.
excuse me, high sugars, high blood pressure, etc. It's just lacking when it comes to autism that these things are thought of as being separate, and they're
Right.
not.
And there's two things I need to say. First of all, I think as an organization, and I've heard you speak on this too, Phil, we recognize that there are a lot of people on the spectrum who recognize that autism or see autism as just a simple neurodiversity, that it's not a medical condition, that it's not a psychiatric condition, that it's just a difference. And what we're really talking about here today is those individuals who, and they might consider themselves in that bucket of neurodiversity, but they also have some health things that maybe haven't been tied to their autism. And I think that's what this session is kind of thinking about and addressing, is that, if you're somebody who has some health issues and nobody's put the autism lens on that this session is kind of helping with that. But let's talk about that neurodiversity for just a minute. And you've done an excellent job of kind of sharing your views about neurodiversity versus the medical diagnosis of autism. And I think I've heard you do that before, but I think for this session, it's helpful because we're not saying that you have to be medically diagnosed with these conditions because you have autism. We're just saying there's a lot of co-occurring issues that come along with having being on the autism spectrum. So, Bill, I'll let you talk about that for just a minute, and then
Well,
I
it's
have
very
one more thing I want to share before we go into more
sure.
detail on those medical
Yeah, of
conditions that we
course.
see.
Yes, and the tricky thing is it's sometimes challenging, just like anything else, to know what another person may mean when they use the term neurodiversity.
Mhm.
When you hear that from someone, by and large, large numbers of people who use that terminology, and I've used it, you've used it, we've all used it,
Yeah.
um, is that cases of autism where people are pretty much functional. They
Mhm.
can live on their own. They don't have constant struggles with severe intrusive medical problems that they are associating with part of the autism. They have some of their own unique characteristics, just like any other person does,
Right.
with their thoughts, their moods, their behaviors, their interests, their social interactions, and all these kinds of things. And they generally do pretty well. And so I think many people in that situation have really felt, rightly so, very defensive to be labeled as being
Sick or
abnormal.
ill. Yeah.
Yeah, mentally or physically ill, and that their mood and behavior and that their tendencies and mannerisms and ways to interact with people are freaky, abnormal. They don't want to be viewed that way, and they don't agree with that, and neither do their families and some other practitioners. So that's just part of diversity,
Right.
and so it's neurodiversity is that term. Then we have other people who have autism. They clearly have autism, and they're very severe. They struggle with the intense anxiety, the intense dysphorias, where they're just in a very bad place mentally and physically. Anything from constantly almost suicidal or otherwise self-injurious physically or emotionally. There's a lot of emotional pain and fretfulness that goes along all day, so much that they cannot function, can't work, can't leave their house, can't go across the room and do one little thing, and it's just very, very difficult. Then some of those folks that either on their own or with treatment that someone like you or I have done will go off to college or go into high school or get to school. I sent my son on his van today. He's 25 to his day program. he got there. It was a bit of a challenge. I'd say today was moderate. I had to coax and help him with his anxiety and sort of almost like an agoraphobia. It's really difficult for him to get up and stand up and go out of his bedroom and go down the stairs. And that's very overwhelming for him. And for people who have those kinds of challenges, that is not, I can tell you, I don't speak for him, but it's clear from interacting with my son, and my wife and I know, and he knows, and it's clear, with all of us, that he does not think of himself as being in a normal state. He sees all the other kids in the neighborhood who've grown up and gotten married, gone to college, go out to the prom, take a walk, ride their bike, moved away, independently living, have their own families, and sometimes they come and visit. And he knows that he grew up with them. Some of them are younger than him too. And it's very painful for him to see that. So he's not an example, and I'm not just harping on him. He's not neurodiverse. He has severe autism, which is a disordered, abnormal, difficult, in the words of David Kirby, rest his soul, the investigative journalist, the hellish world of autism. That's what it is for a lot of people. Then when that is also associated in another realm, now bringing full circle, the comorbidities, sometimes severe pain, abdominal pain, horrible headaches, eye pain. I have a friend who's in Europe. Her son, until he got treated by another doctor for oxalates, which is one of the syndromes our kids have that can cause severe pain in sensitive areas, fingertips, lips, genital area, and in the eyes. Terrible, terrible pain. He was pressing and poking at his eyes at the age of 4 all day long until he got treated. None of the other doctors thought that was a medical problem. They said he's got autism. I hate to paraphrase, but they basically said he's just a jerky kid with autism and he just wants to poke himself. And that's the craziness he has from autism. There's nothing you can do about it. Just keep his hands away from his eyes. The moment she went to another physician who I happen to know and I respect quite a bit, he immediately said to go ahead and do some treatments, all vitamins and minerals, nothing else, and some dietary things. And these discomforts almost are gone. He gets little flare-ups of these and is very tolerable. So these kinds of things are not neurodiverse. They're medical problems that lead to mood and behavioral issues, sometimes self-injury and other things, and obvious things like epilepsy. And there's a higher rate of diabetes in our experience with our years of thousands of people among persons with the autism spectrum, because many people who have diabetes have it in the form of an autoimmune disorder, especially when it emerges before age 18, especially in earlier childhood. So the long and short of it is, neurodiversity is a wonderful concept. It does apply to a lot of people, and many people do very much feel and are vocal about it because they don't want to be labeled. They don't think they're abnormal, and I support that. I'm not, quote unquote, giving permission for that. That's their right, just like any other person.
Exactly.
But some of our kids and adults on the autism spectrum have said, for example, Holly Robinson Pete's son used to say he doesn't want to be called autistic. He wanted to be called, the description he favored is that he is at the time, I think he was 16-year-old who with autism.
Right.
Just like a 16-year-old
and again, there's all those
with
differences.
Diabetes.
Yeah, there's people who say, I don't want to be called with autism because I don't want to be called with, because I wouldn't be me without my autism. But I think we've covered that. And I think it's important to cover that because in other words, this session is not saying that because you have autism, you have this medical condition. It is, however, saying that many people across the autism spectrum have related medical conditions that most doctors don't put through the lens of autism and don't understand that there is a high amount of relationship between these conditions. I think you've mentioned that. We've talked about autoimmune a couple times, talked about diabetes, we've talked about seizures. And it's interesting because one of the things that I heard a number of years ago that really rang true for me is that being autistic is tremendously energy consumptive, meaning that it takes a ton of energy to be on the spectrum. And that as a result of that, that you're more
Very much.
susceptible. In other words, because you use more fuel to get through every single day, that you're more susceptible
Yes.
to having these other conditions. So it's a heightened stress response in the body that is there from the time these individuals are very, very young, and living that life with that heightened stress response makes you more susceptible to some of these things that we sometimes don't, that we see in other populations, certainly, but that we see in a high numbers in terms of autism. And I think, Phil, you've talked a
Yeah.
lot about the GI. So let's start there, because I think there's so much mind body connection that comes between the gut and the brain. And most people don't understand that. So let's
So
start
true.
by talking
Yeah.
about those relationships a little bit from a medical standpoint, and also kind of what the trends are that you see across the spectrum as it relates to that disruption of GI.
Well, the first time I ever heard about autism, I was in high school, and I remember very briefly a very cutting edge teacher of mine in high school, who was an older guy, Mr. Kane, was really contemporary and very up to speed on anything that was emerging. And he showed us a session of one of the therapists, non-medical treatment with a child with autism. It was a graduate student who was basically using aversive therapy with this little boy. And then a little bit of emotional reward at the end to try to connect and bring out some emotions in him. And there was nothing mentioned about anything medical with that at all. Whereas I already knew that, I knew a few teenage diabetics at that time, some friends of ours, and I knew that wasn't a medical illness, but they also had some issues that affected them in terms of their social life and their interactions with other people and so on and so forth. And so then fast forward to just learning more about autism and so on. The first autistic person I ever saw was my son. It was just emerging to become more common, and the numbers have exploded. Some people argue against that, but there's really no denying it. I mean, that's maybe a talk for another day, but there's huge numbers of people with the spectrum now. Over nearly 20 years, in my own practice, and even before then, having seen a very minimal, number of autistic persons before that, then of course thousands of outpatient visits and some inpatient care and things with my practice, I had one patient, just one, who did not have GI problems.
Out of thousands.
Just out of all
thousands.
those others.
Yeah.
Just one. And I mean pretty severe. Pretty severe. Yeah. And most of the time it involves yeast overgrowth, abdominal pain, poor digestion. You mentioned, Marlo, Dr. Thurman, that the consumption of energy we have, and when your GI tract doesn't absorb your energy from food and doesn't absorb the vitamins and minerals that let you utilize your energy, that's what vitamins and minerals are by and large for. They let you use what you ate and what you breathe in and all that. That's what they're for. So several people, and my son has had his ups and downs with this too. He's 25 years old. He's not as tall as he probably would have been. He's certainly thinner than, you'd expect. He's just over 100 pounds. Most 25-year-olds are way over 100 pounds. And so, I was over 100 by the time I was 13 probably, or whatever I was. And so he sometimes will eat more than 3 adults would eat in a day. And he'll do that at one meal, and he just doesn't put on the weight. He'll put on a little bit, and then he'll dip down. Now, he's gone at times when he's got flare-ups of his GI problems and when it's difficult for him to eat, because GI problems sometimes often involve not wanting to eat. And he has abdominal pain and a lot of other issues. But a lot of our kids and adults with autism and spectrum issues have abdominal pain, and they have poor appetite sometimes, and they just won't eat sometimes for days. And then there's the kid that always eats more than everyone else, but
Right.
weighs less and doesn't grow and so on. And you feel lousy when I mean, I'm into fasting, and you and I've talked about this before, and we've all, kind of heard of it. I've done that, and some days when I fast, I feel lousy. I've never lied to anybody about that. Other days I feel better and mentally clear and all that, but you don't feel great, especially the first couple of days when you're fasting,
Right.
with the yo-yoing that some people with spectrum issues do. And even if they eat and their GI tract does not absorb the nutrients properly, it's as if they fasted.
Right. And we also see the kids who are very obese and just keep eating and not ever really drawing the nutrients they need to the point that they're kind of compulsively eating. We see that group as well.
We do, and it's high calorie malnutrition. Derek Lonsdale, when he was alive, who treated a lot of the medical aspects of pediatrician from England and then through Canada, came to the US. And many years ago, he just passed away in his 90s. When he was in the middle of his career, he was at a major medical center, and he wanted to do nutritional treatments and vitamin treatments that were life-saving for some of the patients that he had. And not all of them had to do with autism, but he kind of stumbled into autism because people came to him. And later in his career, he switched into his own facility, he and another doctor, and they did a lot of these treatments. And the GI tract is part of the reason why he did those things, because the GI tract doesn't work well. More often than not, it's autoimmune and a lot of reflux. And then there's either extremes of horrible constipation or horrible diarrhea. And I don't mean the mild
Not a
version.
little. Yeah, you're talking about a lot. Yeah.
It's very severe. Kids who won't have a bowel movement for 2-3 weeks, and they don't have any identifiable other problem medically.
Right. So let's talk about what that looks like in our adults, in the adults that you saw in your practice. Because obviously and by the way, many of these individuals have lived with GI issues their whole life. That becomes kind of their norm. But what do you see in the adult population? What are the questions that you are asking adults to kind of weigh whether they do have some of these medical kind of coexisting conditions?
Well, they may volunteer what their main problem that they have is. And if they talk about something that's overtly gastrointestinal, for example, that they have terrible reflux, and if they eat past 2 p.m. in the afternoon and go to bed before midnight, then they just have horrible reflux and it's just burning, and they choke and wake up with burning and choking and so on and so forth. They may have distensive abdominal expansion. A lot of people who are sort of would be narrow waisted, they have a protuberant bubble like forward kind of expansion of the abdomen, and it's not a spare tire of fat tissue around all the way around.
It's actually an abdominal extension. Yeah.
Right. It's not fat, it's not fat tissue. Right. It's expansive gas and thickening and inflammation. When you bang your hand with a hammer accidentally, it swells up, it gets inflamed. The immune system responds by trying to heal the tissue right away there, and swelling is part of that. The walls of the GI tract can do that and become hugely more enlarged than normal. Retained bowel movements, whether they're diarrheal or constipated, will add to the expansion. And when the immune system sends white blood cells in there, that can amount to a huge amount of material that adds further to it. And there's a lot of swelling, and it hurts or just abnormal. And people know that. Now, sometimes they'll mention something to me that immediately makes me target the gastrointestinal tract. Rashes are a perfect example. So eczema and psoriasis and some of these other rashes, flaking skin.
Hives is another one I'll throw in, hives.
Oh, yes. Yeah, your allergies and things of that nature. Yeah. Many times, if we do gastrointestinal treatments, we can reverse, improve, control, lessen, or help further, instead of the patient having to take steroids all the time, like prednisone. There's nothing bad about that per se, but if there's a better way,
Right.
because prednisone long term almost always has negative effects on people.
Yeah.
Anything from cataracts to diabetes to high blood pressure, to excess weight gain, in quotes, the average way of saying that. If we can help people, and antihistamines make you sleepy. When I was a young doctor and I was looking under the microscope, I would get seasick, and Dramamine helped me with that. That's an antihistamine, but I was sleepy all day, and that's not good when you're a young doctor.
Yeah.
So,
So now
um,
let's talk about the cognitive pieces because we know there are a lot of cognitive relationships between how our gut is doing and how our mind is doing. So let's talk
yes,
about those pieces a little.
yeah. And so sometimes when someone says that they're really foggy minded, or they get sleepy in the afternoon, or their mood and behavior flares up periodically, then I sometimes ask them what they're eating. I often do. I always end up doing that, and
Yeah.
ask how their GI tract is at the time. And they may never have noticed, but they often coincide with flare ups with each other.
Right, right.
And so
Yeah.
we've put people on gluten-free diets because for many people with autism spectrum, adults who have epilepsy and some other issues, and flare-ups of worsening of difficult to control autism symptoms, where they may just be unable to attend a meeting or get in a car and go and just do their job every day, and deal
Well,
with
the
the
anxiety,
overwhelming.
we know the anxiety, we know the depression is really related to GI. I mean,
And
there's pretty
sometimes
interesting
these,
research right now
yeah,
just on the depression may be autoimmune and gut related all the way through.
yeah, two things. The brain and the GI tract are very similar sets of cells. They're two piles of cells, but
Hmm.
they're arranged differently, and they're hooked up and connected one cell to the next in a different way. So they operate differently on the superficial level, but they're very similar. Most of the neurologic cells, the neurons in the body, are in the GI tract.
Right.
A lot more are in the lungs, and then there's the next two places are the brain and the spinal cord,
Right, right. But a
and they're very
lot in,
similar.
yeah, a lot in the GI system. Yeah.
Yeah, very much. And so we've put some people on gluten-free diets because the gluten is actually the same chemistry family as endorphins.
Hmm. Right,
That's not always the reason why it helps people. We know there's celiac disease and all that, and that
right,
has to do with gluten. But
right.
gluten is in wheat, barley, oats, and rye, and there are some gluten-like substances in other grains, and those sometimes are a real problem. I've had some people call me days into the diet and say they're 80% better just from the diet. Sometimes it takes weeks and weeks and months. Paul Shattuck, who's still alive, and Carl Reichardt, who's passed away out of Europe, the two doctors, two doctor and a pharmacist, did a lot of work on this. They found that gluten um, lasted in some people's systems, especially adults, for up to 3 or 4 months after you stopped eating it. And so they thought you needed to, their work showed that for many people, you needed to stay on that diet. The trial needed to be at least 3 months, sometimes longer.
Well, and
Other
I've heard
things
it
that,
put this way, Phil, that again, because autism is in itself a stress on the body, that foods that are harder to digest become problematic for individuals. And it causes the gut to not, in
very
other
true.
words, that the gut just isn't functioning as optimally as it could if the body wasn't under so much stress in the first place from the autism. So, yeah. I
Well,
want to
it's true. No.
yeah, I want to talk about something that I think is also really important. You've talked quite a bit about seizures, and we generally think, oh, I know, I would know if I'm having seizures or if I'm not having seizures. As somebody who has a seizure disorder from a traumatic brain injury myself, and it's not classical grand mal, I have partial and temporal lobe seizures. I'd like to talk about that because I think not only do we know that people with autism, that a lot of people with autism have seizures, but there are a lot of people on the spectrum who may actually be having partial or temporal lobe type seizures and not really even know that
Yes.
that's what's going on. So let's talk about that for a minute because first of all, we know there's a high relationship between autism and seizures. So let's talk about that first. And
There
then let's
is,
talk about some of these
you know,
different types of seizures and how those can manifest. Because I think that, certain clients I've worked with, I believe, are having kind of a
mhm.
complex seizure reaction when they have these
Yes.
meltdowns that they have.
Oh yeah, yeah. So conventional, again, self-appointed conventional medical people who are very good, and I'm I've got one foot in that, kind of category as a conventionally trained doctor in many ways. Um, have said just outright that 25% of persons with autism have seizures. Overt epilepsy, basically, is what they're saying. Now, not just grand mal, but all the different types that are recognized readily by physicians and nurses and others and family members as seizures. I think it's a lot higher than that. I think that there are other forms of seizure activity and brain discharges that are in the that aren't continuous and aren't recurring, but they have a background that flares and comes and goes and rears its head at times and changes the way the brain works. And Landau-Kleffner syndrome which was outlined starting really in the 50s, the 1950s, all the way through the 1960s, is something that never used to be diagnosed very often. And basically, what it means is your seizures may sometimes be overt and grand mal, but there are times when many patients who have seizures continue to have seizure activity. They're talking to you, they're walking around, but it's affecting the way the rest of their brain works. And so they can't think the same way and have the same ability to function the same way and do the same things
Right.
and remember and interact and do all these things that we don't think of as having anything to do with seizures. That part of their brain function globally doesn't work real well. And so
Right.
we
And
know
I
when the arms and legs jerk.
Right.
Excuse me,
We see that
that's
classic seizure look, but there's a lot of different types of seizures that can be affected. And by the way, even the relationship between seizures and migraine headaches, we know that that's kind of a continuum, right?
that. And yes, and gluten intolerant syndromes, celiac, was outlined in the late 40s, early 50s. And quickly after that, it was clear that the brain gets heavily affected by gluten in celiac disease. And whether the person with celiac who goes off of gluten, and this is true of our persons with autism, whether they go off the gluten or not, they, excuse me, often have abnormalities that continue. And so they may improve, but they have abnormalities. Now we've had some cases where when we people on gluten-free diets, and then there's about 5 major diets out there for autism, and there's others that are many different kinds. But when you put people on these various diets, sometimes they'll stop having seizures, or they'll get much better control with their medication of their seizures. And they don't have these intervening periods of time. We know when people have, quote, regular seizure syndromes, the ones that are accepted as clear-cut seizures, that there's the postictal period and the premonitory period, and these instances where they're not thought to be seizing, but their brain is affected and they can't function. They sleep for 24 hours. They have to call off work. They're not able to drive a car for a while. And it's not because of their medications or anything, because it's not just the seizures over and done with and you're done, bam, wham. It's because the brain gets affected continually by these abnormalities of waves and spikes of electricity and things in the brain. They really do.
Right.
So seizures are the opposite of a stroke in a way. A stroke, unfortunately, damages a part of the brain that becomes quiescent and doesn't have electrical activity. And then so your arm won't work and you can't move it. Okay. That part of the brain that works that. Whereas you might have a person who's fidgeting around with their hands, and a seizure is driving them to be kind of, excuse me, a seizure is driving them to be restless.
Right. Exactly. So
And
we talked
it can
about
also affect other parts of the brain, excuse me, where
Yeah, go
your
ahead.
mood and how you view things is not able to function the way it can. And so you can have a different view. That's what Landau-Kleffner syndrome in many ways is all about. It's a seizure that affects the way various parts of the brain work, not just grand mal.
Well, and I can speak personally, and again, my seizures are secondary to a traumatic brain injury, but I definitely can kind of sense like heightened, really extremely heightened sensory sensitivity can precurse a seizure. Definitely disruption in sleep. Post seizure, I can definitely have some impairment in terms of being able to really form and speak for a little while, kind of that foggy thinking. And when you think about some of those symptoms do kind of cross over with some of our autism symptoms. So, like I say, just something to know about. I think it's helpful for all of us to kind of have that in the background that that's a common coexisting condition with the autism spectrum. So, we've talked about GI, we've talked about kind of the diabetes version of that, we've talked about seizures. Let's talk a little bit about some of the autoimmune things that you see. And then the last thing I'd really like to talk about is kind of susceptibility to opportune kind of infections and viruses, right? Because we know that's part of the equation as well. So, yeah.
Yeah, these are very important things that you bring up because they do affect a lot of people. We all know people who have rheumatoid arthritis. We all know people who have asthma. We all know people who have psoriasis.
Mhm.
These are immune dysfunction disorders.
Right,
When your immune system's sick, one of three things that can happen. You can have allergies to things that are basically harmless.
right,
Things in the air, things in food that otherwise would be harmless to you. They're not poisons, they're not toxic. And then so you can get anything from rashes to asthma and these kinds of things. And sometimes those are pretty severe. You can also have um, inability to fight infection. That's a big part of what your immune system's supposed to do, right?
mhm,
That's the main thing most of us think of when we think of a normal, healthy immune system. That when we change the baby's diaper, there's a lot of germs on that diaper. And then we wash our hands. And when somebody next to us has a cold and you say to yourself, oh my gosh, I hope I don't get that cold, and we don't get it, we got exposed to it. That's been shown in all kinds of research. And some people in the room get the cold and some don't. And it all has to do with whose immune system was able to fight it off before it got started. And some people will get a mild version and sniffle for a few hours and get a scratchy throat. And then by the next morning, it's gone. Others will have 3 weeks of coughing and phlegm, and they get an antibiotic, and then they get steroids, and then it takes them really a
yeah,
month to get over it. And it has to do with your immune system. Then there's I think, the most severe, and that is when the immune system doesn't work, it doesn't know friend from foe, and it attacks our own body.
right,
And if it attacks the brain, you get brain symptoms. If it attacks your joints, you get joint symptoms. If it
right.
attacks your GI tract, and all of these things can happen, the skin, the eyes, the pancreas, where you make insulin and control your blood sugar, and so you don't have diabetes and things. If those things get attacked by the immune system, you can have a breakdown of those functions and get anything from headaches to confusion to seizures
Right.
to autism. Many persons. There's a whole brain bank that had been started many years ago, and when people who had autism and were unfortunately, early killed by a car accident. This is, I'm not trying to be harsh, but that
Right.
or a
But yeah,
fall
we're
or
able to
some
see
injury
their
or some
brains when
other
they were
illness.
young. Yeah.
Right. And then the brains were analyzed for people who signed up for this ahead of time and wanted to have this, tested. There's a lot of inflammation and autoimmunity in the brains of autistic persons. And
Yeah.
it's not every single person and not every doctor agrees with that, but it was
Right.
found in a much higher level
Right.
than was previously thought at all by any blood tests and CAT scans and things like this.
And again, it's
So
very
when you
chicken
get
or egg. Does the
autoimmunity,
autism cause the autoimmunity, or does the autoimmunity and inflammation cause some of the autism symptomology? I don't think we know. I don't think we're saying that which came first. We're just saying that there's definitely a relationship there for a lot of individuals.
Yeah, I mean, I think you said it best. We can't say, and we don't know to say which quote unquote came first. But
Hmm.
that's this whole problem of not from you, Dr. Thurman. I
Right.
know you are aware of all this, but that's the whole problem of thinking as autism in a compartmentalized way. Oh, it's psychiatric, and some people happen to have diabetes, or some people happen to have brain dysfunction and seizures.
Or
Autoimmunity.
depression or suicidal ideation
Oh
or
yes, yeah.
cutting behavior
Autoimmunity has
or
been, yeah, it's been
addiction
shown to
or
cause.
yeah.
I'm sorry, go ahead.
Yeah, that was kind of my little ranting list there.
Well, I think we're saying the same thing. When I was a young doctor learning in the internal medicine department at Mount Sinai Medical Center, where I did a lot of training, I learned about lupus cerebritis, meaning people had lupus and it affected their kidneys and it affected it's an autoimmune disease, affected their feet and their hands.
Mhm.
But it also could make people act, in the words of my boss at the time, crazy,
Yeah.
meaning that there are times when they had psychiatric mood and behavioral manifestations
Right, right.
because the cerebral cortex got inflamed. There are
Yeah.
some wonderful things out there from psychiatrists looking at everything from toxins to infections in autism and in non-autistic states where it was thought to be a purely psychiatric syndrome, and treatment for the actual cause made things better. Michael Ches, Dr. Ches, is a neurologist who moved from the Midwest and did work there and in California, was using steroids. Now, he doesn't want to use steroids on people just willy-nilly, if I can say it that way, but
Yeah.
he did when he thought they needed it. And many of the patients he did two things. He always checked for seizures, and even people who didn't have epilepsy and didn't seem to be seizing had a high rate of epileptiform activity on the EEG, the brainwave tests. He
Mhm.
always insisted on doing that. And he treated not all, a lot of those patients, in addition to vitamins and minerals, a lot of them with steroids if they
Right.
were recalcitrant. And many of them got better because they had autoimmunity to the brain.
Right.
That's what his diagnosis was. That's basically it.
Yeah, so let's just take a couple minutes and talk about those opportunistic infections because I do have one really important question I want us to cover before we wrap up and we're
Yeah,
going a little long. But like I say, so explain to us why individuals with autism are more susceptible. I think we've kind of talked about that. Their immune system is kind of under more stress, and so they're more vulnerable to
yes,
which might be Lyme, and maybe give us some examples of some of those opportunistic infections that you see really affecting individuals across the spectrum more so than in other populations.
yes, yeah. I'd say yeast is number one.
Hmm.
That we're all exposed to yeast and molds and fungus are all in the same family, and they
Hmm.
can have
Yeah.
various forms. But most of us have, again, as a young doctor, before I ever knew much, if anything, about autism, um, I was in the autopsy division at the hospital, and I worked there. And the AIDS epidemic came along before there was any treatment for AIDS. And we saw people with terrible yeast and fungal infections because their immune systems didn't work.
Right.
Well, people with autism don't have HIV. I'm not saying that. They're two different
Right.
things.
There's
That's
not that
completely separate.
relationship. Yeah.
Right. It's not that severe, but when your immune system doesn't work, one of the things you're very susceptible to is yeast, and it can grow in the GI tract and make yeast toxins that affect your body. The most common yeast toxin is available at every bar and grill in the United States, and people know what it's like to have their mind affected by alcohol when they get drunk. And so some kids and adults, some of the adults act that way and without having any alcohol
Right.
because they
They've
have
got a
yeast.
buzz without without
That's
drinking.
right.
Yeah.
Yeah. And then staph germs and strep germs are germs that are always trying to attack our bodies. And most people's immune system are just too darn good to let it happen. But
Right.
then they may get the occasional strep germ. They may get the occasional staph infection and acne, pustules and scratches on the skin that flare up, and then they scrub them out, and then they get over the infection or they need an antibiotic for a few days. That just doesn't work for our kids. It doesn't help, and for our adults, really, now we're talking about
Yeah.
adults. I was consulted on a farmer who was healthy and perfectly well until a piece of farm equipment smashed his foot. He did not have autism, but when he was in the hospital, he got an infection, and the cultures grew strep germs, and they used antibiotics. And he was brought to the hospital because his family was unable to deal with severe OCD.
Right.
And he had a strep infection,
Bing,
which
bing.
usually is in the throat, but was on the skin. And
Yeah.
until that got treated um, aggressively, then he wasn't, supposed to be on the psych ward. And the social service workers who worked the psych ward at that hospital tried to convince the doctors to treat the strep germ just like they were treating the OCD. And that happens with a lot of our adults with spectrum. If they get a strep infection or a sinus infection, there are many names, pitans, pandas. They get a flare up of autism. They get OCD. They get more of the repetitive sameness
And more
symptoms. That's hard
reactivity
for them to control.
meltdown too. We see a lot of that really
Mhm.
kind of those blowout meltdowns really tied to some of these, infectious diseases. Yeah.
And then chronic infections. You mentioned Lyme. There are other bug-borne infections. Bartonella is another one. The psychiatry literature shows that those things can cause cognitive and behavioral disorders.
Mm-hmm.
And until they're identified, sometimes the shrinks, the psychiatrists and psychologists, I'm blessed to have you in our presence right now, know that they have to make sure that their patients go to a good internist or the family doctor to make sure their thyroid works and that they don't have infections and
Yep.
some issue that can be remedied to help tone down or improve their mood and behavioral problems. So it's really standard to make sure that there isn't a medical basis for this. And again,
now
this
you're
is
getting into
that's
my very last question. So what do we do? I think, you and I have talked about this a lot. So many times and I share the story about the young man I worked with who had literally bowel obstruction from long-term constipation.
oh yeah,
And
yeah,
he was referred to me for his fear of defecation when he was in so much pain that of course he's afraid to try to go to the bathroom. He's in
yeah.
so much pain. So you and I have talked about this, but let's talk about what needs to happen. What needs to change? How do we need to address these coexisting conditions for individuals with autism better?
It's doctors, medical doctors only do two things. We do tests and we do treatment. And in order to address things and do tests or treatment, we have to, in the words of my boss, another boss, I've had many good bosses over the years who've taught me, important things about being a physician. In order to diagnose and treat a disease, you first have to think of it. You have to consider that it may be the cause of the problem. And in the broad sense, as we talked about in the very beginning today, autism has many underlying associated medical problems. I personally have said for many years, and many other physicians believe this, thousands of physicians, scientists, autism is a medical problem, and the severe aspects of it manifest as mood and behavior, quote unquote, psychiatrically. But unless we treat the medical problems, then it's a real problem. So diabetes, for example, the doctors will ask their patients from head to toe who come as adults who have diabetes, how does your brain work? And have you ever had TIAs or strokes or these things in the stroke family? How's your vision? Eyes are very severely affected by diabetes when the diabetes is not treated. How is your stomach and your gastrointestinal symptom, gastroparesis, all these diabetic syndromes?
Right.
What this really means is, what are the syndromes? We talked about them all today, okay? What are the syndromes that are commonly associated medically in autism? Well, we go over all those things with our patients.
If you come in with autism, here's the questions that I'm going to ask you medically. Yeah.
Does your autism flare up when you eat something? Did you ever notice that? Does your GI tract flare up when your autism flares up? Do you have pain in your eyes? Do you have pain in your joints and in your skin? Do you have times when you've gone to a doctor and they've tried to treat an infection what's your digestion like and your bowel movements. We're very extensively asking people. A lot of people don't want to talk about this, and the doctors never ask about their bowel
Right.
movements and so on.
And
But
the
it's very much the case.
psychiatrists really oftentimes don't ask these questions because you're going in for a psychiatric, maybe
Of
you're going
course.
to treat your anxiety. So then all this stuff gets missed because we're focusing in on the symptom of depression or anxiety or impulse control or executive functioning when really it can have a physical cause.
Yes, and it's true. And so psychologists, psychiatrists, educators, you've been a forerunner in all those fields, are doing good things when they concentrate on the psychiatry of the
Right.
patient. However, they they really don't
We're
do
missing, we're
medical
missing
treatment.
the
We know a
physical.
few. Yeah. So this is where the medical system has, in the words of many patients, this is their words, has failed, them medically when they go to a doctor with autism because they have autism. So this is one of the situations where people need to be their own advocates, not because we're trying to force them to do it, but because
Right.
sometimes that will help your doctor to really either do tests and treatment or to refer you to someone who does that.
Right. And by the way, and don't take, well, it's just your autism. You have to accept it and live with it. It's just
Mm.
part of autism. Because if you came
Well,
in with a bowel blockage and didn't have autism, in no circumstance would they send you home and have you seek psychiatric treatment for that.
absolutely true. Absolutely true. If someone started really putting their finger in their mouth and biting it because their finger hurt, the doctor, if they didn't have autism, the doctor would say, well, let's look at your hand and why is it hurting? And oh my
Why is it
goodness.
hurting so bad? Yeah. Yeah.
And they do an x-ray and they would do circulation tests in your arm and they would make sure they did nerve conduction studies and EMGs to look for carpal tunnel syndrome and look for neuropathies and all these different things, and that's good. But
Right.
you're so right, Dr. Thurman, they wouldn't
Yeah.
do it. Usually that doesn't happen for the autistic person,
Right.
and it
So,
should.
and it should. And I think that's our main point is that, that we have these coexisting conditions. By knowing about them, we know that it's part of our autism. By sometimes we're having to educate our doctors saying, well, gastrointestinal problems are pretty common for people like me
Very.
who are on the spectrum. And I would like to be treated appropriately for my GI issues
Mm-hmm.
in the same way that we're treating other people who have GI issues. I think that's kind of a nice way to think about it. So here we are at the kind of end of our session, Dr. Demio, and I'd like you to kind of maybe take a little summary wrap up for us and share with us kind of what you think the main points that you would like someone to take away from this session today. If maybe they're just seeing the
Mm-hmm.
last few minutes of it or they want kind of us to wrap it up for them.
I would say do what you usually would do when you think you need to see a doctor or go to your nurse practitioner or the PA or the dentist or whatever, your family doctor, really, who, when you're having a flare up of some things that are on the autism spectrum for you and your symptoms, whether it's a flare of OCD or whether it's being overwhelmed or anxious or depressed or suicidal, yes, get help from psychiatrists, psychologists, counselors, whatever you need to do for that, but also get medically assessed for that. Okay. And when somebody's confused walking around in the street in the middle of traffic and the police are called and the person gets, kind of stopped by the police, if they have a diabetic, wristband identifying themselves, they'll go to a hospital, they'll get their blood sugar checked to see if it's too low or too high, because that can cause that kind of thing. So just like that, when the mood and behavior and cognitive function of a person with autism flares up and gets worse, that needs to be medically assessed just as much as it needs to be psychologically assessed.
Yeah, and I like the word function. In other words, there's autism and then there's the function of autism, right? In other words, this idea that I can be an autistic person and be completely neurodivergent and happy and content with who I am. But when my functioning is not to the level that I want it to be, to know that
Yes.
that may not be just a psychiatric part of my autism, that there may be physiology or coexisting medical that goes with that, that I can treat the function. I can treat myself as an adult who is not functioning in the way I want to function through not only psychiatry, psychology, and some of these
Yeah.
other behavioral methodologies, but also through the medical arena and the medical lens. And I think there's not that many doctors out there that really understand that. So find one who does. Dr. Demio was involved in kind of building kind of biomedical training for physicians. There are some organizations that do that. And there are, in most states, there's usually one or two good kind of functional, integrative, or biomedical doctors who really do treat people with autism. So be sure and find somebody. And if your doctor's never heard of this, that doesn't mean it doesn't exist. So keep looking. So
Yeah,
thank you
and
so much.
this is where you've got to be your own self advocate, which anymore, I think you have to do that no matter what kind of patient you are when you go to a
Yeah.
doctor. Yeah.
Well, I also think you just knowing that this whole lens of autism is pretty cutting edge. It's kind of new. So you're not, so, a lot of
I
these
think
older
so.
doctors who went to medical school 10, 15, 20 years ago, they've never heard of this before. This is completely foreign to them. And so you're going to get a lot of shutdown on, wait a minute, my autism may be related to my gastrointestinal issues. Let's look at that. That might
Yes.
not be something your doctor is gonna immediately embrace without some formal kind of support from you or other doctors who are more trained in that. So, Dr. Demio, thank you
Yeah.
so much. I really appreciate your contributions to our organization. Dr. Demio is not only one of the kind of the founding members of the original US Autism and Asperger's Association, which is the kind of the organization that was formed before this organization, the US Autism Association, under the Different Mind Renaissance. But he was also a good friend of Dr. Larry Kaplan. He's on the advisory board for the US Autism Association. And I think you understood that he has an adult son. So he lives and walks and breathes the treatment of autism. So thank you.
Thank you, Dr. Thurman. Thank you
It
for
was a
bringing up
pleasure.
these very important issues.
Yeah, it was a pleasure. I enjoyed having you on our contributing to this conference, and we look forward to hearing from you again. Thank you.